The comfrey plant can contain pyrrolizidine alkaloids that can be harmful to the liver if overconsumed. Over the centuries, comfrey tea has often been consumed regularly without observed liver effects. However, beginning in the 1970s, research on rodents concluded that comfrey consumption could harm the liver. However, the doses given to rodents in this research was extreme when compared to what a human might consume of this herb. A 1989 study tested 29 healthy people who had been consuming comfrey for many years. Their consumptions ranged from half to 25 grams of comfrey leaf a day for up to 30 years. The researchers tested their liver enzymes, including AST, along with bilirubin levels. These markers are for liver inflammation or other liver harm. All those people who had been consuming comfrey over the years tested in the normal range for these liver enzymes and liver markers. In addition, a few single cases were reported with some suspicion that the internal use of comfrey might be linked to something called veno-occlusion. This is when liver blood vessels are damaged. However, an analysis of these case studies by Dr. Dorena Road found the comfrey consumption link was weak at best. Most of those in the few reported cases also were taking other drugs linked to liver harm and veno-occlusion, including NSAIDs like ibuprofen, aspirin, and naproxen. Even if there is something to these, this sort of liver risk would not apply to the topical application of comfrey. This is because the skin doesn't efficiently absorb pyrrolizidine alkaloids. Also, the majority of these alkaloids in plants are naturally in the N-oxide form. N-oxide alkaloids do not readily convert to the toxic forms of PAA, and N-oxide alkaloids are excreted quickly by the body with little risk of harm.